There's a new conversation happening in Washington, D.C. with the goal of improving access to mental health treatment. This is an announcement that came from the U.S. Department of Health and Human Services telling states that they will be able to seek a demonstration waiver, a Medicaid demonstration waiver, to get rid of the exclusion that was on institutions of mental disease, those facilities that are a little bit larger, and by larger we mean over 16 beds, that house inpatients for mental health treatment. There was a long-standing rule excluding these institutions from Medicaid reimbursement. Now, HHS is telling states you can get around that long-time exclusion to make sure that you can get Medicaid for mental health treatment in certain facilities. Now, we're talking about two populations that would be inpatient in these facilities. The first one goes by the acronym SMI, the adults with serious mental illness. The second category is children with serious emotional disturbance, referred to by the feds as SED. So they're calling this Medicaid demonstration that states would be eligible to ask the feds permission for the SMI SED demonstration opportunity. So in other words, a Section 1115 demonstration waiver saying we can do our Medicaid program a little differently than what federal law allows by asking to be able to reimburse Medicaid payments to facilities that are larger than 16 beds that have inpatient for mental health treatment. So that's a mouthful, but it's being heralded by both providers and mental health advocates as an improvement. And this has been a long time coming. This is typically for an average stay in a facility of about 30 days. So it is still considered a short-term inpatient stay. And states have to meet certain specifications for this to be allowed. And we'll talk about that in just a second. Secretary Azar, when addressing state Medicaid directors about this new opportunity for demonstration waivers, is quoted as saying, more treatment options are needed, and that includes more inpatient and residential options that can help stabilize Americans with serious mental illness. So he is addressing with things like the opioid epidemic and more individuals being seen in crisis in the emergency room instead of getting treatment in an inpatient facility where it's appropriate. That's coming to a head, and they see this as a solution. States need to prove a continuum of services for patients, not just this Medicaid eligibility. States also need to prove no extra cost to the feds for this to happen in their waiver, which is typical of a Section 1115 demonstration waiver, that it be budget neutral. Ongoing conversations will happen, and this is part of a conversation that's been evolving for the last several years. In fact, it was the Obama administration that loosened some restrictions on payments to some of these facilities back in 2015. The Trump administration actually took the baton on that and started loosening restrictions even more, allowing for waivers in the year 2017 for inpatient treatment for substance abuse. And the way that this language looks now for access to mental health treatment for inpatient stays looks very similar to that substance abuse waiver. 17 states requested that substance abuse waiver. The data is just now starting to come in on how that's going, and the results thus far have been largely positive. It's something the feds and the states will continue to track, especially as they try to prove budget neutrality. You can read that new letter to state Medicaid directors from Secretary Azar, where he spells out what the intent of this new waiver is and how it'll function. If you have questions as we keep reading through this ourselves, you can send it to us and we can get back to you at healthwatchwisconsin.org.